7. See that there's, pretty good. It's kind of the and now the labrum down the front of the shoulder. Okay, great. Now just behind that to the left is the subscapularis tendon. Right there, I'm lifting it up right now. That looks fine. So we've got a little bit more fraying in the anterior labrum here, which is usually pretty easily addressed with the shaver. We'll go off on the video for a minute. Okay, so this is the back of the shoulder joint, the glenohumeral joint. Posterior capsule looks fine. Posterior humeral head looks good. You've got some changes in the cartilage at the posterior edge back here. You can see that right in the middle of the screen. But in general, you don't have much what we would call arthritis. The cartilage surface of the glenoid and the humeral head up above, for the most part, look pretty good. So we're going to go ahead and use our shaver here to smooth out this posterior labrum, and then we'll show you what we do with the biceps tendon. Here's our shaver coming in. We're just going to work right here. And you can see here, this cartilage is pretty loose in this posterior glenoid. This is where these loose pieces were coming from, I think. You can see our Dionic shaver there. We're just removing everything that's loose because we don't want this area to keep generating loose pieces of cartilage that can potentially bother you. So in some of these areas are going to be down to probably subchondral bone here, because you see a flap like that, I don't want to leave it. The shaver works really well to just remove that pretty quickly, as you see. So we'll keep working here and get this back to stable margins. Okay, so we're pretty much done removing all the unstable cartilage. You can see it leaves us with a defect in the posterior glenoid that's maybe, I don't see a mark, and there's a centimeter. So we're maybe 5 millimeters in size. Shouldn't be enough to be significant clinically. But I just didn't want to leave anything that was going to continue to generate loose pieces. And this might be something where we actually do consider using our biologics like PRP to get this cartilage to firm up and create a healing response. Now I'm going to go ahead and address the biceps next. So I'm going to need a spinal needle, and then we're going to use a relay, and then we're going to use a suture to secure it. No hook, just a grasper right now. So I'm trying to get high up in the interval here. And there you can see I'm coming right through the biceps, right through the middle of it. I realize it's torn, but we want to get right through the middle of the torn part. The relay. Hold the camera right here for me, just like that, 2 hands. Yep, great. I'll get it. Don't stay on screen. If you got that, you got to stay there. While it's recording. Okay, so we're going to go ahead and grab that wire, back the needle out, and now we're going to load that wire with a suture. We'll show you what that looks like. Okay, so that's one pass. We're going to make another pass through the same region of the biceps tendon. Different angle though. That's pretty good there. Sometimes when the biceps is torn like this, we'll even make 3 passes. Okay, so now there's a little trick here that I want to show you. We're going to grab the relay just like we did before, but here's the trick. We're not going to pull it straight through. We're going to go ahead and let go of it and sneak around behind the biceps like that. See how we're behind it now? And now we're going to grab it. And the reason we do this is, especially when this tendon's not in great shape, this gives us, hold the camera there again, this gives us a much better hold on the tendon. So now when I pull back through, you'll see the difference. So now if you watch carefully, when I pull tight on the suture, it's going to go all the way around. See that? It gives me a good solid hold, even on a tendon that's torn or split in a type 4 slap lesion situation. So I'm happy that we have a secure hold of it. Now I'm going to take a pair of scissors and cut it at its base so that it'll never bother you inside the joint again. Here's the scissors. They just cut like that. Hold this. Just about like that. And you can see we're just taking our time working across the base of this tendon. A little bit more. I think the rest of that I'll use my shaver. Okay, and so now you can see that biceps is released. Hit the up button on the pressure. And again, that doesn't grow back, so that's a one and done type of procedure. We'll clear up the picture here a little bit. But that's really all we have to do inside the joint. So now I have a good hold on the biceps. We're going to reattach it up in a different part of the shoulder. Your rotator cuff looks good. And I'm happy that we've done everything we came to do inside the joint. So we'll go off on the video and show you some more in a little bit. Okay, so we're up in the subacromial space. We're using a device that removes some of the soft tissue from underneath the bone. It's called the Flow 90. It is super cool. It's got suction built into it, and you can see that it very quickly removes soft tissue, basically using heat. So for that reason, we can also stop any little areas that might be bleeding or anything like that. So it provides cautery as well. Now we're going to go ahead and use a burr just to make a little more space here. I've looked at the rotator. It looks great. I don't see any tearing on the bursal side. Of course, from the articular side, it looked good also. So I think we're in good shape as far as the rotator cuff goes. Okay. I'm just trying to get so we can get a really good look at the rotator cuff. And all the way in the back here, the rotator cuff looks good. We can rotate the arm. And now we're going to go ahead and put our burr on. With our burr, it's going to just remove a little bit of bone up in the front here, just to make a little more room for the rotator cuff. The speed lock anchor, and we're just going to use this to secure the biceps and complete this biceps tenodesis. I just want to give you kind of an interval shot. We're going to bury the anchor all the way up to that black laser marking right there. And so the next thing we show you will be that anchor that you can see kind of the edge of the white anchor there. We're going to take that down to the bone. Hold the camera. Okay, so I want to show you. We got that speed lock down. You can see the sutures that are holding the biceps. We've just made a little hole right there, right at the interval to secure the biceps, and now that biceps tenodesis is complete. We took a little bit of bone off just to primarily so we could see better, but we didn't really have to do a huge decompression. Of course, your cuff's not torn, so that was another reason not to need a decompression. And I'm happy with the way that looks. Again, the biceps has been tenodesed. You can see, you can just get a hint of the sutures there if I look down at them for you. Okay, and so we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.